External examination of the body. External examination is very important, especially in cases of trauma where a number of injuries are visible externally. Following point must be noted. Record height, weight, age, sex, general features, asymmetry of any part of the body. Build like cachexia may indicate malignant neoplasm, circumcision, clubbing, internal neoplasm, lung disease, inflammatory bowel disease. Cyanosis. Some pathologists tend to avoid this term using bluish discoloration. This book. Cyanosis in life is produced by reduced hemoglobin 5 gram per 100 blood, methahemoglobin 1.5 gram per 100, sulfur hemoglobin 0.5 gram per 100. Development and nourishment. Distinguished features such as amputation, deformities, malformation, moles, scars, tattoos, ethnicity, race, hair condition, jaundice, biliary obstruction, liver parenchymal disease, hemolysis, lymphadenopathy, reactive or neoplastic, muscular wasting, pallor, anemia, pregnancy, carbon monoxide intoxication, suffocation, state of cleanliness, hands, trace evidence, not any material clenched in fist, button, fiber, or any other trace material should be carefully collected and placed in an envelope. Nails, take nail scrapings and put in an envelope. Scraping is done either with a matchstick or with a filter paper twice folded. Scrape gently without using too much force in order to avoid contamination with the blood or epithelium of the deceased. Use separate envelope for each nail. At least 10 envelope should be used. Put a scraper in the envelope to seal each envelope, label it indicating which finger it represents. Skin, note blisters, color, different color with different poisonings, general condition, loosens, needle mark, pallor, petechia, rash, reflective UV photography for demonstrating for faint mark, bruises not visible in normal light, target ulceration, eyes on conjunctiva, petechia, anemia, tachynoira, pupil, meiosis, mydriasis, equal or unequal, palpate abdomen to identify ascites or any intra-abdominal masses or organomegaly such as enlarged spleen, liver resulting from an infective, reactive or neoplastic process. Breast in female is essential to avoid missing any palpable lesions. This will also be sliced at a later stage for examination. Testis in males examined after removal. Also in suspected sexual assault, swabs from vaginal, anal, oral area or any other suspected area. Use UV light to detect invisible seminal stain. Pubic hair, comb and collect any loose hairs. Submit for forensic analysis. Mated pubic hair should be cut out with the scissors. Stains on skin, note stains due to blood, corrosives or other poisons, crushed grass, feces, grease, gunpowder, mud, oil, vegetable juices vomited. Describe them precisely and detail. Signs of disease, note presence of dropsy, edema of legs, eruptions. Okay. And skin disease, surgical emphysema about the chest, time since death. Note from rectal temperature, rigor mortis, postmortem staining, putrefaction. Head hair examined minutely. Presence of mud, soil, grass, leaves in the presence of head lice indicates poor socio-economic condition. Remove any foreign matter with a forceps. Comb the hair for possible evidences. Take samples of both cut and pulled hair from at least 8 different areas of the scalp and labor their origin. Face, a froth around nostrils and mouth, pallor and petechial hemorrhages. Eye notice, color of sclera, conjunctiva, eyelid, opacity of cornea, lens. Periorbital tissue for extravasation of blood, petechia, softening of eyeball, state of pupil. Also note artificial eyes, contact lenses, spectacles, intact or broken ears, note leakage of CS of blood, neck, note bruises, fingernail abrasions, ligation, nerve, lymph node, neck vessels, degree of distension, any other abnormality, lymph node enlargement, meeting, cervical, axillary, inguinal lymph node, thyroid nodularity, size, thorax, general outline, flail chest, symmetry, breast size, masses, whether colostrum can be expressed, color, size, shape of areola, nipples are retracted, POD orange, abdominal distension, retraction, scars of operation, stria gravidum, umbilicus position, back, bed sores, postmortem staining, spinal curvature, deformities, external genitalia, edema, general development, local infection, Position of testis, nature orifice, examine mouth, nostrils, ears, vagina, anus for blood, foreign matter, injuries, presence of froth from mouth and nostrils, blood tinged or not, size of individual bubble, coarse or fine leathery, coarse or fine leathery. If mouth cannot be opened, divide temporalis and masseter muscle above their insertion into the mandible. Jaw becomes mobile. Note: smell from mouth. Poison detected by smell. Tongue coated, dried, furried, leathery, moist. Color, signs of corrosion. Position with relation to teeth. Protruding. Border between teeth. Presence of or absence of bite mark. Epilepsy. Facial fractures. Note the state of lips, both outside and inside. Gums, teeth. Broken state of eruption. Stain. Cheek, both outside and inside for injury. Marks of corrosion. Limbs. Note position, particularly of arms, hands, fingers. Examine hand for callosity and bone. Clumping, corrugation, defense wound, edema, electrocution mark, gangrene, hair fibers, pieces of cloth, buttons, etc. Clenched in fist. If clenched hands cannot be opened, cut of flexor tendon at the wrist. Injuries, needle mark, tumor ulcers, fingernail broken, finely trimmed or overgrown. Dirt, grass, mud, sand, soil, flesh, blood entangled with them. If face, gently scrape with a toothpick. External injuries, wound, examine systematically so that none is missed. A good working order is going around the body as follows: head, right upper limb, right lower limb. Left lower limb, left upper limb, front of chest, abdomen, back of chest, abdomen. Description must include base of color, dimension, length, breadth, depth, but do not probe penetrating injuries until a body is open. Direction, ends, extension, extremities, weight, height from wheel, margin, nature, position, size and shape, state of healing, trauma to viscera. If injuries are obscured by hair as well as the scalp, shave them gently. Associated malformations. Associated information whether there is any coagulated blood or condition of their edges. Estimation of force required. Estimate evidence of bleeding in nearby tissue. Presence of foreign matter, fiber, grass, hair, maggots. Collect all foreign matter for analysis. Caused before death and after death. Time of infliction, burns. Note character, degree, extent and position. Diagrams of all injuries should always be made with the proper labeling in such a way that they correlate with the described wound. Thus, a reference to measurement, distance, or anatomical landmark, state of healing, etc. can be easily made. Some pathologists use printed body sketches for this. This may not be always be basal, etc. when there are multiple injuries on face or other similar anatomical region in a printed sketch. Such areas or small and injuries may not be depicted conveniently. In such cases, it is far better to make a large sketch of face and then depict injuries. Photographs are useful. Diagrams cannot be made for some reason. They faithfully reproduce everything around the injury. Nothing is left to chance. They must attach it with the postmortem report and note made on the report regarding the number of attached photographs. Disparity with inquest report. Usually the examination by police person is very shoddy. There would be many times by disparity between injuries noted by police and by the doc. In such cases, disparity should be brought to the notice of the police officer so that he can make the necessary correction in the report. Fractures and dislocation should be made noted by palpation. Attempt to move joints. Confirmation by dissection. If radiography of the dead body has been done, correlate the description with the X-rays. Thank you.